I'm going to start. Hi. My name is Nancy Lazerson. I'm a speech-language pathologist. I've been working with people with Klinefelter syndrome for 17 years. Some of you have heard me present maybe at Axis. I presented for KS&A a long time ago. And I live in San Diego, so I got to come up today for the day, which was kind of a nifty little drive. I'm not looking forward to the drive home. The drive up was great because I left really early and I made it here in under 2 hours. So anyhow, what I'm going to try to do today, because I have like an hour, right? We have till 12:15. I'm going to try to touch on a little bit of everything. In the past, up until a couple of years ago, when I spoke to Klinefelter syndrome families, I focused a lot on just basic speech and language issues. But over the years, one of the things that I've learned is that our kids with KS have really significant pragmatic social deficits. And were some of you here earlier when Nicole Tartaglia was talking about medication? Some of you were? Because she was talking a lot about anxiety and depression and social anxiety issues in kids with KS. And it's all part of a piece, that they have some difficulties with the social functioning that is tying in with their difficulties with language deficits. I'm starting to see crossover with kids getting autism diagnoses. Sometimes it's an appropriate diagnosis. There is a new body of research starting to show that a significant group of kids with autism also have chromosomal variations. It's a newer body of research. I think we're going to see more coming out. The problem is that when you have kids who have isolated social pragmatic deficits, the school districts, particularly here in California, don't understand Klinefelter syndrome, but they understand autism. So often you kind of want that big A just to get in the back door of being able to access some of those social pragmatic issues. But we'll get to that. So anyhow, I'm going to assume that most of you are parents. Is that an accurate assumption? That most of you have a child with KS? Okay. All right. You're going to have to be patient with me because I'm not the best person with technology. Okay. So normal speech and language development, we're looking at children developing the structure and content of language, the vocabulary and the grammar. They need to be able to understand language. They need to be able to understand the grammar and the vocabulary. They need to be understand spoken language, understanding what's heard. As kids get older, they also need to be able to understand what they read. If kids can't understand what they hear, if they don't have that language comprehension, they are going to have difficulties understanding what they read. Oh, there we go. So in young kids with poor receptive language, they have difficulty following simple directions, difficulty answering simple questions. They don't necessarily respond in conversation. They don't understand their peers and don't seem to know a lot of words. When I start talking specifically about XXY, we know that receptive language is stronger in XXY kids up until a point. And I'll talk about what that point is. In your young KS kids, birth to age 5, 6, 7, you're not necessarily going to see receptive language deficits. You might, but it's not as obvious as the expressive deficits. In older kids, receptive language starts looking like having to break down directions. And I'll have a parent of a 12-year-old say, oh yeah, he can follow directions, but I have to give them one step at a time. Well, that's how you give directions to an 18-month-old. So parents tend to adapt to what their kids are doing. Now, some of that difficulty with following directions can also relate to auditory processing, and we'll talk about that too. I have a lot to talk about. They may not be able to answer questions related to information in school. So they may be doing okay in the classroom, but when they come home to do it at home, and you say, well, how did you do this in school? What did your teacher tell you about it? And they go, I don't know. They don't pick up on new vocabulary as well. Kids learn a huge amount of vocabulary by the time they're freshmen in high school. and it goes exponentially this way for a while, and then as they start getting older, it goes this way, because first they're just building words upon words upon words, and then as they get older, they have to start doing something with those words, so they have to do prefixes and suffixes and antonyms and synonyms and related words and all that kind of thing. So vocabulary grows both ways. Older kids will have difficulty understanding grammar, and they might not understand the language of instruction. So they might be able to have a conversation, they're following the conversation okay, but the teacher always says to you, he never does the exercises right. Or he says to you, Mom, I never know what she's talking about. So as kids get older, they've gotten this foundation of receptive language. They have a vocabulary that they understand. They understand that if Mom says, tomorrow we are going to go to the park, versus yesterday we went to the park, they have that understanding of grammar. As kids get older, they need to start doing something with that language. They need to process it. They need to apply it for higher level thinking. This is where our KS kids, who may have looked great receptively as a 4-, 5-, and 6-year-old, second grade, third grade, when they start having to do inferencing, main idea, drawing conclusions, being able to make predictions, that's where all of a sudden their language hits a wall. And that's where sometimes kids who have never been identified as having a language deficit often start getting identified late second, early third grade. And there's three different times, there are three sort of different milestones where kids who've been previously unidentified will get identified. And that tends to be third grade, sixth grade, and ninth grade. Those are the ages at which instruction changes radically. In third grade, the kids go from learning how to read to reading to learn. In sixth grade, they generally go from learning in a single classroom with a single teacher to going from class to class. And then in ninth grade, they're in high school. And those are big changes, and that's where we tend to see kids who have previously been unidentified. When we look at higher level language, which is where our KS boys start to run into problems, abstract vocabulary, multiple meanings, synonyms, and homonyms. And multiple meanings is one of those things that people don't necessarily think it's important, but it's a really important skill because you can't understand wordplay and jokes if you don't understand multiple meanings of words. And understanding how shifting a word in a sentence can change its meaning. The book was picked up by the boy versus the boy picked up the book. And kids who have higher level language processing don't get that. And so when teachers change how they talk as they get more abstract, kids start getting lost. Figurative language, idioms, sarcasm, and indirect requests. Now that's a biggie when I talk later about pragmatics, that middle one, that figurative language. That's where, again, our kids with Klinefelters get lost because they don't develop those skills. And then the other kids, by junior high, language has become very slang. Kids are very sarcastic. And kids who don't understand sarcasm get their feelings hurt really badly. And I'm going to talk a little bit, I'm going to show you a video later about bullying, which is a big deal for our kids. Main idea, inferential thinking, making predictions, and drawing conclusions. Those are all higher level language. And that's where, again, those are receptive language, those are language processing skills where the Klinefelter kids were looking okay receptively for a long time. And then as these skills start being necessary in the classroom, you see them starting to break down. So, by the way, I don't mind if you ask questions in the middle. I'm going to try to go quickly because I have so much to try to fit in.
Do those things come in later, with the later development or whatever?
No. Do you think, are these skills just going to magically emerge one day?
Yeah. Are they going to emerge later, or are they just going to always kind of be deficits? If they've been deficits?
I think if kids have been in therapy and you've been with a good speech therapist who's knowing to watch for it and can do some proactive kinds of help, you may not see it develop as a problem, but it's unlikely to just all of a sudden magically appear one day. I've met a lot of KS adults who will say to me when they hear me talk for the first time, oh my God, this is why I can't keep a job. you know, because these are deficits that were never addressed, and they never even realized necessarily that it was a deficit until it was pointed out to them, and they're like, oh, this is why I have such a hard time with social relationships, and this is why, and again, when we get to pragmatics, you'll see where it all interweaves.
I have a son going into 3rd grade, and would you recommend a speech therapist with a certain, just because I might think he has this, and I would go ahead and put him in for once a week, just because, is there a specialty?
No. What I'll tell you about speech therapy and Klinefelter syndrome, and I get calls all over the country from people, and I get emails, there are speech and language deficits common to Klinefelter syndrome, but not unique to. So you just need to make sure she does the right tests, and I can talk to you about that, about what to look for to identify. And if they give the right test, it really doesn't matter if they know Klinefelter syndrome or not. It only matters that they know higher level language. That in and of itself is a challenge. A lot of school-based speech therapists don't get it. So depending on where you are, I don't know if you're California or if you're, where are you? I'll help you. Don't go to Newport Speech and Language Centers. Other than that, I'll give you some. And this is so important because as kids move up in grades, language becomes more abstract. Social functioning relies on these skills. The ability to function socially. And like I said, I'll talk about pragmatics later. And they have to be able to explain, defend, and analyze, particularly as they get into the upper grades. Now, since the onset of No Child Left Behind, being able to analyze is a skill that is not exactly being stressed anymore in high school like it used to be, depending on where you are and what kind of a track your kid is on. But they better be able to do these skills when they get to college. And unfortunately, it used to be that the high schools did focus more on these kinds of skills, but now everything is so test-driven that kids are not learning these. And so if you have friends, I have lots of friends who teach at a college level, and they're all pulling their hair out because the newest kids coming through high school aren't learning these skills. Oh, I'm sorry. My water here. Okay, this thing is like really annoying. We talk about auditory processing. I know that Dr. Lucker was here. Did people hear him talk? So I'm not going to do a whole lot about auditory processing other than my own little spiel about it, which is that it is separate from language processing. I can only speak for California public schools. Our public schools don't like to acknowledge auditory processing as a separate deficit. The American Speech Language Hearing Association has position papers on it, getting the school districts to get in line and do auditory processing testing the right way, which is with an audiologist and a speech pathologist, is very difficult. I was just involved in a due process hearing about that very fact, and we got our butts kicked, unfortunately. So, but this is the bottom-up information, is the raw sound, the phonemes, the sound patterns of the rhythm, rate, and intensity, and that's a bottom-up skill. Starts from birth, where kids recognize mom's voice, they can hear changes in language. There's this top part of it, which is what you do with it, which is thinking about language and thinking about thinking. That's sort of the auditory processing piece. We do see in our Klinefelter kids, the kids that I see coming through my office do have auditory processing deficits. I have a really good audiologist that I refer to who happens to be in Laguna Hills. So, and I put this in big letters because this was the whole function of this due process hearing that we just had. The guidelines from the American Speech Language and Hearing Association are that you have to have an audiologist involved in the diagnosis of auditory processing. What the school districts are saying is, well, we gave the TAPS and we gave the CTOP and we put goals in the IEP for auditory processing, so it doesn't matter who did the diagnosis. And it does matter because there's different profiles of auditory processing, decoding, encoding, et cetera, and that's going to depend what kind of treatment you do. So it's very important that you have an audiologist involved in the assessment if you're concerned about auditory processing. And there are some good people and there are some not so good. I can tell you the good people in California. I don't know as many other places. Where we really look at with our Klinefelter kids is where we first identify their speech and language issues has to do with the expressive language, because our little Klinefelter kids often don't talk. They're often very quiet. They have the shyness. Their expressive language is much more delayed. My first ever Klinefelter child, when he was 3, I saw him in speech therapy for 2 years, and for the first 6 months he never uttered a sound in my office. But his mom always stood at the window and watched, and when they would go home, whatever I had done, he would do at home. So for 6 months, I had to put up with silence in the office, but it was like I was a data input thing, and he always did it. And then after about 6 months, he finally started talking in my office. The magic was bringing his sister in. But that child just graduated from high school with honors and is now going to be attending San Diego State University in the fall. So that's really exciting. He's the one who got me started in all this. I was just so proud when I got the graduation notice. So we work at vocabulary, syntax, and morphology. Kids who don't talk well don't write well. It just comes because you write like you talk at the beginning. And so kids with severe expressive language deficits are going to have difficulties with written language. Add to that often our Klinefelter kids have fine motor deficits, and writing is a terrible chore. And one thing I will tell you is when you get your kids to 3rd grade and they're starting to really struggle with the amount of expository writing that they have to do, check and make sure whether it's a mechanical issue or if it's the expressive language issue, and push for an assistive technology evaluation and get them an Alpha Smart or a writer or something that they can use in the classroom. Because kids with expressive language issues that carry over into the writing, who also have the fine motor, are punished so severely by the way writing is taught in school by having to sit and write. So bypass that by getting them assistive technology, and then they don't even have to, it doesn't become an issue. Give them an alternative way to write. And if they're going to say, well, they have to learn cursive, no, they don't. Cursive is an anachronism. Nobody has to learn cursive. So, but getting that assistive technology assessment through the schools can make a huge difference, getting your kid an assistive technology.
How do they get through the elementary school and all that and not learn cursive? My son's only 2, so...
Well, you do what I did with my own child who doesn't have severe learning disability, but he has a mild visual motor integration deficit, and I just said to his teacher he's not doing cursive anymore. I just said he's just not going to do it. Well, she did because I had to put on an IEP.
In Florida, they dropped that.
Yeah.
It's no longer part of the curriculum.
Yeah. And really, in another 5 to 10 years, the kids are going to be walking into junior high with a laptop, and it's going to become a non-issue. Now, there are OTs who will tell you that cursive is actually easier, but with some kids, it's how they learn to write. And the problem is that for kids who have that mechanical piece of writing, they may have some good ideas, but the mechanics bog them down so much that they never write what they're capable of writing. The other thing is say, you know what, my kid has these deficits, he needs to dictate to somebody else and let somebody else do the writing.
I was just going to ask about that. The dictation, that's something that I do a fair amount.
Oh, absolutely.
Too. That's not horrible.
Norma can talk to that because her son he dictates everything to his teacher. Because if she waited for him to write everything, she would never see what he knew.
Okay.
He did. I'm sorry, I'm laughing, but that's fun. To me, it's funny. It took 10 minutes for him to write, "Hi, my name is Sam."
Yep.
10 minutes.
Whereas he can tell his teacher, because he'll dictate to his teacher a whole paragraph of information.
Okay.
So.
I just want, being my 3rd conference and those of you who have the young children, I am glad I didn't know he could get out of it though at this point. Because you don't know what it is. Because I think my son can write mine. It is a little harder than the other
right.
kids. But the fact is, he's powered through. I didn't give him the opportunity to not do it. And I think that's a really important thing through all of this.
Yeah, and I think, like with my own child, it was really a question of he was struggling so hard with the cursive that it was bogging him down so hard that he was become writing resistant. He's now relearning cursive with a different method in occupational therapy, and it's gorgeous. He's got this beautiful handwriting now, So, but it's how they teach too. So
I have a question on the other slide.
Yeah.
Just quickly.
Oh, how do I go back?
Difference between grammar and morphology, or
Okay, the difference between
so rhetoric. Where does that?
rhetoric. You mean like for older kids being able to?
Well, I kind of see syntax and morphology as the same, but
No, they're not. They're two separate skills. Syntax is the structure of the sentence. So understanding that no, nope, no, that's semantics. Those are semantics. Syntax is the grammar. So understanding that you have to put a do before a sentence to be able to ask a question. The dummy do. You have to be able to say, do you want to go to the store? Understanding interrogative reversal. This is a pen. Is this a pen? That's syntax. Morphology are the little itty-bitty meaningful units of language. So the ed ending, the apostrophe s, the plural. That's morphology.
So when my son says our instead of we, he'll say our go to the store.
That would be morphology.
Okay.
That would be morphology. Yeah. General guidelines. I want to see a 2-year-old have 100 words before I'm going to feel happy. And I want to see an 18 to 24-month-old start putting together some simple 2-word utterances. Now, someone was asking me about I do it. I do it is not a 3-word utterance. I do it is a chunk. Because they're never going to say it separately. It's a chunk. I want to go is a chunk. That's how kids learn language. They learn in chunks. A 2-word utterance is going to be mommy shoe, daddy car, baby go, where they use these little pivots. So short sentences by 36 months. Now, I sat in a meeting where a nurse, school nurse, was saying, well, you know, from a pediatric medical perspective, if the kids have 100 words at 3, that's fine developmentally. Now, this is a meeting that I was at as an advocate, and I said to her, well, gee, from a speech and language developmental perspective, no, it's not. And so you need to be very cautious if the pediatrician says to you, oh, it's okay that your 3-year-old is only saying 50 words. It's okay. They'll grow into it. No, they won't. So for me as a speech pathologist, I want to see a 3-year-old with a nice, healthy 100 words at least and doing some little short sentences.
My son's 25 months. Okay, he was just diagnosed last week with apraxia. He mainly only uses vowels for things
Right.
and very little words.
If he's apraxic, first of all, he's too young to be diagnosed with apraxia, because a diagnosis of apraxia, the kid needs to have enough of a vocabulary for you to be able to put a sound structure to and figure out if it really is apraxia. It could be, there are other things it could be,
Like for sissy, he goes E.
Right. And
he does use like nana once in a while for banana. He hasn't said that in a long time, but he uses hardly any consonants.
And that may be apraxia, and there's different schools of thought about apraxia. I'm not comfortable with apraxia diagnosis until the kids have enough of a vocabulary to put a sound system to. Who did? Yeah, and he may well be, and we do see apraxia in the KS population. What you're going to listen for is does he go so that you have a sense that he's getting some sentence-ness. He just doesn't necessarily have the sound system to put to it yet.
His expressive language came in between 9 and 12 months.
Yeah, so it's delayed, and
18 to 21.
And so it's likely that the expressive language is delayed by the inability to make sounds at this point. It's going to be hard to judge. First, you've got to get a sound system into his language before you're going to be able to know what else is there. That's going to be the therapy. That's going to be his speech therapy.
What do you call that when you get the, without words, but it's the inflection?
That's the prosody. That's the inflection, and that's the prosody, Prosody. And that lets you know that they have the inflection patterns and they have wordness. And you see that even in typical developing kids. You might see a typically developing 10-month-old who doesn't have words yet, and mom's on the phone and she's there with her banana going, na 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 na. And that's a normal developmental thing. If a kid's doing it at 3 and they don't have the sounds yet, then you're more concerned. Okay? So if your 12-month-old isn't talking, your 2-year-old has no words, and your 3-year-old can't talk in sentences, you should be concerned. You're all concerned because your kid has Klinefelter syndrome, and you know that language deficits are part and parcel of it. So you're all going to be very active, and when I talk to families and counsel families with Klinefelters, I always say it's good to have a baseline speech and language evaluation at 12 months and another one at 18 months, so that if you need to have early intervention, you can get started as quickly as possible and get it going, because we know that early intervention works. I'm going to breeze through some of this stuff only because I want to try to get to the pragmatic thing. But the difficulty using language to explain, describe, and argue, that's when you were asking about rhetoric. This is rhetoric right here. That's what would be considered rhetoric. Okay? Briefly, as kids start learning language, they frequently become disfluent because their brain is going much faster. They're developing language faster than their mouth can keep up. There's what we call developmental stuttering, which is where kids go, mommy, 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 I want a cookie. And you're sitting there going, oh my God, he's stuttering! And you call the doctor. When it's that kind of stuttering where it's whole words or phrases, it comes on suddenly, it goes away suddenly. That's not stuttering. Stuttering is when kids are blocking and they might have a tick and they're going, you know, and you're thinking, and they can't get it out. That's more of a real, true stuttering. Speech is the ability to make the sounds and sequence them for language. Apraxia, and I like to make this clear, apraxia is a motor planning disorder of speech. And it has to do with getting the mouth to plan and execute the motor movements in speech. You often hear, and there are people who do evaluations who are in this field with Klinefelter kids who will say that because Klinefelter kids tend to be low tone in their faces, they are then necessarily going to have apraxia. Tone and motor planning are not related. A kid can have low tone and still be able to make the sounds of speech. Tone becomes an issue when there's a strength problem and they don't have the strength to move the musculature in their face, and that would be considered what's called dysarthria. And that's a separate disorder. So you have to be very careful, especially in very young kids. So apraxia is a motor planning deficit of speech. So when if your child is diagnosed with apraxia, that early speech therapy needs to be focused on the patterns of speech. So I don't necessarily want to see them come in and do, you know, this sound, that sound, this sound. It's all about sequencing the sounds into speech. A truly apraxic child can usually make all of the speech sounds. They just can't put them together into speech that's meaningful. So there's articulation, phonology. Articulation is your basic lisp. Phonology would be classes of sounds, and that's used to be called phonological processing disorders. It's kind of gone out of favor as a term. And that's where a kid might, every time they need to say K, they move their tongue forward and say T. So cup would come out tup, or go would come out do. I want to do into tar, mommy. You know, and that's a phonology error. And then apraxia, I just talked to you about that. It's not due to oral motor weakness or low tone, and it doesn't affect feeding. Now, there's a separate disorder called oral apraxia, which is the patterns, being able to do the patterns for feeding. And kids with oral apraxia may have a feeding issue. But apraxia of speech is a very specific motor planning deficit to speech. It's a term that is overused, and the experts in the field estimate that it's overused by 75%. No, yeah.
Is prompt therapy a good?
Yes, prompt therapy is one of the best therapies for apraxia. So finding a prompt therapist, if you can find one.
I live out in Timbuktu. So.
Where do you live?
Gillette, Wyoming.
Good luck. Go onto the prompt website and find, see if you can find somebody. It is a very good method. But there's also, I used a very low-tech, method. It was moving across syllables, and it's just a syllable sequencing. As long as it's a developmental approach, it doesn't need to be anything fancy. But prompt that's the good stuff. Low tone and feeding issues. If you have a child who has low tone in their face and is having problems sucking, swallowing, chewing, that's more likely dysarthria, and they're two different disorders. But, and this is just really important, there's very little data to suggest that low tone in the facial area necessarily affects speech development. So your little puffy cheek Klinefelter kid, you know, a lot of the little ones do have those little puffy cheeks, and they don't have the best tone in their faces. That doesn't mean they're not going to develop normal speech patterns. It just means they're puffy cheeked. And cute. Apraxia is not treated with blowing whistles, straws, or other mechanical tools. However, dysarthria might be. If there's a weakness issue and if the kid just doesn't have the muscle control to get their lip up to close it, then you might want to get out a whistle or something, and that just depends on the skill of the therapist. There is absolutely no evidence that oral motor exercises do anything for apraxia. So if you go into an IEP meeting and the speech therapist says, I'm going to work on his apraxia with oral motor exercises, you say, I don't think I'm going to sign that goal. Or you say, which really, really makes them angry, you say, can you show me the data to support you in using oral motor exercises to work on my child's apraxia? And they'll go. So they say, let's do something else then. So there's the thing. So interestingly, I've now been involved with Klinefelter syndrome for 17 years. And every year I look through my journals and I'm waiting for somebody to write a study about Klinefelter syndrome in language, and I'm just still waiting. Oh yeah, that's right, because I could if I had time. But there's anecdotal reports, and we know what we see. And again, I think the reason there isn't any really strong research is that, as I said earlier, the deficits are not unique to Klinefelter syndrome. They're just common to Klinefelter syndrome. So now, they don't necessarily have all of these. You know, sometimes we have kids who look pretty good, and that's great. But the most common are the expressive language deficits of delays in speaking, where they're just simply late to start talking, syntax and grammar, poor word retrieval, poor verbal organization, sequencing, and written language difficulties. Generally, vocabulary is intact up until that higher level vocabulary starts to kick in. But just the number of words is generally pretty intact. The standard bearer being the Peabody Picture Vocabulary Test. Most of the Klinefelter kids that I've tested over the years have done fine on it. So they know the words.
This list, is that from your own observation, or is there some research behind it?
This is from my observation, my anecdotal, and then what I've picked up in the little bit of research that I've seen over the years. Yeah.
Would it be the poor verbal organization if they speak very, very fast and are not understandable?
Yeah. Well, and they're disorganized. So if you ask them to give you a narrative, tell me about the movie you saw. Well, and then they did that, and then no, maybe they did that first, and then they did that, and you don't know, or what'd you do in school today? Well, we did that, and then I think, and because of the poor word retrieval, you get a lot of stuff and junk and thing, and so and he and she without necessarily knowing which he and she they're talking about, so you get that lack of reference. Yeah.
The last speaker said, they will respond to therapy.
Yes. Oh, yeah.
Is it reasonable, just so I have my expectations here, that, if my son is, he's only 2 now, but if he's 18, is it a reasonable expectation that if we continue to work on this, there will continue the improvement? Or are some of the higher level language, is he just going to top out at a natural level of ability?
Well, I think what I've seen over the years is that you have kids, you get through different stages. So you have a Klinefelter kid who isn't talking at 1, and you get him lots of therapy, and they walk into kindergarten looking good. And the speech therapist at the public school says, I'm not going to give him therapy. He looks great. And then they hit about 3rd grade, and there's a new milestone, and what's happening is the bar keeps going up and up and up. and they may lag behind a little bit. If they get the right kind of therapy over time, by 18 they may look great, you know. But you have to be proactive and you have to be on top of it, because they may look okay for a time, but you don't want to always assume that it's going to stay that way. So it's always good, you know, even when your child is discharged from speech therapy, the best person you can have in your back pocket is a good speech therapist. Every 2 years, call them up and say, can you do a recheck? And they'll say, well, he's doing fine. I need to know. And get a good evaluation every couple of years. It's money well spent, because the language issues drive the learning issues.
I know there are people who do puzzles as they age to kind of keep using certain muscles, and it seems like this is an area where, you know, you're past the remedial, but you can do a lot of exercises to just keep it in the forefront of your mind.
Absolutely, absolutely. And then I talked a little bit about the receptive deficits. Kids may be slow to process auditory information. I've had families say to me, you know, my kid is just a beat behind everybody else. And that's where getting a good auditory processing evaluation, if it's a speed of processing issues, there are therapies that work on that. You know, working in conjunction with an audiologist, sometimes working with an OT, doing programs like therapeutic listening, interactive metronome. Some of those programs can help speed up processing a little bit. The other thing with KS kids is they may have phonology disorders early on, some delayed speech and language development. They may have apraxia, and they may have what I call just an imprecise articulation. They just kind of sound mushy. And some of that mushiness may be that they were apraxic early on, didn't necessarily get therapy for it, and then as they get older, they just turn into mush mouths. Now, there is what happens also, though, when voices change and the esophagus lengthens and the sound is bigger inside the mouth, typically boys will go through a period of mush mouth because there's all this new sound inside their mouths from the deeper voice, and so they kind of get mushy anyhow. So it's good to kind of figure out where it's coming from, that mushiness. So, okay, briefly, the pragmatic deficits is that the kids with Klinefelter syndrome may have difficulties understanding the informal language of the peers. They may have difficulty interpreting sarcasm and slang. And expressive language deficits can affect the social functioning. If you don't have the same expressive skills as your peers, you can't keep up, particularly as they get into junior high, where it all moves really fast. Junior high language is fast. You got to keep up. You know, you have to be able to understand the kinds of jokes and the sarcasm and the slang that they do. And then the other thing is the social conventions, and that's where sometimes you get this crossover with the autism, because the body language may not necessarily match well, and the tone of voice. Now, if you have a kid who's got an apraxia, they may not have the changes in their vocal range, and their speech may sound very flat. I just was working on a case of a child who's got a degenerative muscle disorder, and his social skills really are fine, but the other kids aren't interacting with him because his face doesn't show affect anymore, because of the degenerative muscle thing, and his voice doesn't change. So the other kids are in 5th grade, they don't want to talk to him. So there's a lot of different things that can affect it. Many of the language deficits can persist into adulthood. When I meet with Klinefelter adults, they'll often get an aha moment, as I said earlier, figuring out that some of these deficits were there and have an impact on their later life. I want to briefly, all right, where did it go? Just when we talk about pragmatics, what we're talking about, the skill that kids need to have is they need to be able to figure out the hidden agenda, because that's what goes on the playground. There's a hidden agenda, and kids have to be able to figure that out. Who am I supposed to talk to? Who's talking here and who's talking here? And that's where pragmatic deficits come in, and our kids who don't get it get eaten up by not being able to figure out these little social nuances and things. Briefly, Oh, okay. Whoops, okay. I was like, wait, it's gone. Oh, there it is. But briefly, socially successful children smile and laugh, greet others, and extend invitations. And that's what we want from our kids. So what I'd like to do is, at the Access Conference, I guess 3 years ago, 2 or 3, when were we in Chicago, Roberta? Okay. In Chicago, one of the moms gave me this DVD. Can you help me set this up? About her son, who's a child with Klinefelter syndrome, who was being bullied in school. He has apraxia, had been in therapy for a long time. And in trying to deal with the bullying, he got in with a counselor who made this video, which was then given to the school, and they included it in a bullying education program. I like to show this not to make you cry, because it's a very moving video, but because I think that our kids are particularly vulnerable to bullying for a number of reasons. One is that social anxiety that Dr. Tartaglia talked about, their shyness that's just part of the syndrome, their language deficits, their pragmatic deficits, their sensory issues, makes them particularly vulnerable to bullying. And so it's so important to the people who know your kids to protect them, and you are their very best advocates to make sure that they're being protected from the bullying. Are you going to be able to handle this, Norma? You've seen it before, so I know you're not.
Every day we come in contact with many different students. Some of these students are just like you, and others maybe not. Some of these students have obvious disabilities like Down syndrome, Tourette syndrome, cerebral palsy, muscular dystrophy, or vision and hearing impaired, or have speech and language delays. For the most part, you are very kind and understanding with these people and should be very proud of your behavior. But there are other students who have difficulties that maybe aren't so easy to see. Students with learning disabilities, Asperger's, cognitive delays, social skill difficulties, or attention deficit problems. These are called invisible disabilities. These students look like you, they dress like you, they sound like you, they want to be friends with you, they want to be just like you. And maybe in your interactions with them, you shouldn't be so proud. Max is a student. He could be any student who comes to school every day just like you. Max has a story we would like you to hear. Whether you know it or not, every one of you plays a role in Max's story. While you listen to Max, we'd like you to ask yourself, what role do you play? And at the end of the story, could you tell us, are you Max? Are you Max's bully? Or are you one of those people that Max is asking to be brave enough to help him?
Kids tease me by making annoying sounds, making sometimes like rumors, and even though I'm Jewish, they just keep on putting cross lines and into my supplies. And sometimes I don't even have the courage to go up against it. Have you ever been there? Have you ever been scared? Standing around and no one cared. You were out there all alone, facing the monsters on your own. When the bullies in my classroom do this, I feel depressed, angered, and discouraged to do my own schoolwork. Can you understand the way I feel? The fear inside makes you ill. Have you ever been there? Have you ever been scared? I'm scared. As a little child, here and there, the monster there beneath my bed. Oh, he was feel like I'm just hopeless to try to do anything. Just because even if I try to work them, they just keep on doing it to me. Just keep on doing it to me.
Teasing and constant threats, didn't feel the regret. I'm not strong enough to stand against stories full.
It makes me sad because I've never done anything to them, and they're just bullying me. They're just bullying me because new I don't understand things. They just think that they can just push me around.
Can you understand the way I feel? The fear inside you makes you ill. Have you ever been there? Have you ever been scared?
When other kids see me being teased, I just wish that somebody would help me get with this problem. Just try to get that person or people to know whatever they're doing is not right.
You say it's not my fight. In a way, I guess you're right. Then again, would you do the monster should come out? You decide it's okay. Another's turn to walk away and leave you out there all alone. Face this monster.
I think they do this because they're popular, they do sports, they think it's just funny to go with somebody weaker than them.
It's all in fun, people say. So a joke, so it's okay. Paid for work, sticks and stones. Too much more.
Why I don't tell them that I feel like it. Because sometimes I feel that they deserve a chance. They deserve another chance after another, until suddenly those chances run out, and it just feels hopeless for me to try to make friends with them. I will not tease, threaten, or harm others. I think that means that I will not hit, make fun of, treat people badly, or any other way that could be disrespectful.
Stand with me, let's make a vow. Hurtful deed we will not allow. Send this message clear and strong. What is right? Have you ever been there?
I was bring others the way I want to be treated. That means I will treat people the same way as I want to be treated. I just don't know how they would feel if they were me and I was doing this to them. I'd like them to treat me and other kids equally. Everyone is is equal, no matter who it is. If you're popular or not, or if you're smarter than even if you're smarter or you're not smart. If you do sports or if you do not do sports, it doesn't matter at all.
Have you ever been there? Have you ever been scared? Looked around and no one cared. You were out there all alone. Faced the monster on your own. Do you understand the way I feel? The fear inside you makes you lose. Have you ever been there? Have you ever been scared?
Max was incredibly brave to do this. It was shown at his school. He made this in with his guidance counselor, and the guidance counselor actually wrote the song and performed it, and they brought it to his school. And really, the message that I want people to take is that all kids are vulnerable to bullies, but our KS kids, I think, are even more so than others, and that every school has a bullying policy. Bullying is an offense. It's just on ed codes, but it's you can take civil action against a school if they're not protecting your child from being bullied. Our kids are vulnerable because they can't come home and tell us. And so when Dr. Tartaglia was talking earlier about some of the anxieties our kids are showing about school, you need to make sure that they're not being bullied, because they're not going to necessarily be able to come home and tell you that. So, on that cheery note, I don't mean to be a downer. I found this video to be incredibly inspiring. That here's this child he's got apraxia, he's got learning disabilities, he's got a whole host of issues, and he was willing to stand up and to do this. And according to his mom, it made just such a huge difference in his school. And the whole climate changed. So one little kid can make a big difference. So I am going to be around, so I hope if anybody has questions, please. Oh, look at that. Right exactly at 12:15. Yeah, that's impressive. So.